Okay, I'm just going to go briefly over a little bit of Bella's therapy now she's a fixator. She has some pins in her pelvis which limit AB and adduction and any rotational movement. So she just has a hinge that allows flexion and extension. And then obviously knee range of motion. So our emphasis is on trying to get as much hip flexion, and usually you just watch these two get close together, and then trying to maintain at least neutral hip extension. She has a hip bar that she'll wear at night. She takes it out when she moves and walks and while she'll be at school, but at nighttime that's what they're supposed to do, just to kind of help with the hip extension. Because a lot of kids with PER, have obviously a deduction, a hip flexion, a contracture. So after the distraction, the hip flexors do get a little bit tight, so we really want to work on maintaining hip extension. Hip extension range of motion is the most important of everything, and then obviously trying to keep as much hip flexion as possible. And usually the hip flexion gets better now that she's done distracting, so over the next 4 months of you seeing her, you'll get to a point where once you get it, you don't tend to lose it. But hip extension can be a struggle, so just really working together with the parents and keeping the hip bar in and just doing a lot of hip extension stretching is good. Knee flexion also tends to be difficult just because the pins tend to, where he places them through the IT band, it tends to be very painful. It doesn't necessarily hurt at the knee, it's usually hurting more at the pins. And then as a result, the knee does get tight just because of that pain. So Dr. Standard doesn't really care about aggressive knee stretching range of motion because he knows it'll come back when the frame comes off, but to do as much as she can within her tolerance. We do a lot of active assistive. She's getting about 70, so if you can at least keep that, that's great. If you get more, even better. But as much as we can keep helps us when the frame comes off so that we can do a lot of the rotational movements. So just trying to keep that 70, and if you can get better, do it, but it's more active assistive. Just trying to decrease guarding with that. So and kind of what we usually start with, she kind of give her a little heat pack, and then we just work on hip flexion range of motion. We try to do some with the obviously knee flexed, and then we also try to stretch the hamstring a little bit and do some with knee straight. So at the beginning, right now, since Bella is still really sore, I really just kind of warm her up for a little bit. And you'll see the motion happening right here at the hinge. And so I'll just spend like 5 minutes at the beginning just kind of doing gentle ones to warm her up. So just warming her knee up and then warming her hip up a little bit before I really start pushing. When we actually do the stretch, to kind of, because of the wrist resistance in the hinge and just to kind of protect the hinge, because it is cemented here together, that they like us really to kind of, if we don't support it a little bit sometimes, it has happened very few times, but the cement can break if you're not giving it enough stabilization. So just stabilizing the hinge as you're taking her into flexion. So we'll do some of those with the knee flex and then with the knee extended after we warm her up a little bit for about 5 minutes. And so we'll show you some of those. You can pause it.